Hello, Mr. Peters. My name is Kevin Zhang, and I'll be your nurse for today. Oh, I see you have a trach, so you can't talk that well, but you can just give me a thumbs up, thumbs down, thumbs up for yes, thumbs down for no, and that will be our good form of communication. All right. So your name was Jordan Peters. You were born in. Your name is Jordan Peters. You were born in April 5th, 1980. Is that correct? Thumbs up, yes. All right. I'll just verify that with your wristband. All right. Matches. All right. So, have you done trach care before? These are my extra pair of clean gloves. Have you done trach care before? Yes. All right. That's good. So just to reiterate, I'm just going to be suctioning. I'm going to be changing your inner cannula. I'm going to be changing your dressing, cleaning your site, and I'm going to be changing your stabilizer to make you all feel better, all right? So, do you have any allergies to chlorhexidine, to tape, to latex, to alcohol? No? All right, that's good. And are you feeling any pain today? No? Okay, that's good. And I'm gonna check your vital signs real quick. Vital signs are stable. I'm seeing your O2 sat is good. It is at 98% set, so that's good. I'm going to ask if you have had or felt shortness of breath. No? Okay. And did you have any difficulty breathing? No? Okay, that's good. I'm going to be listening to your lung sounds. Okay. Breathe in deep for me. Okay. All right. I do hear some secretions in your lungs, so we're going to have to suction that. And before we get started, do you have any questions about this procedure? No? Okay. I'm going to close the door for patient privacy. I lock that. I'm going to set you in a semi-phallus position. All right. All right, you're now in the semi-phallus position. I am going to set up my sterile field. All right. I'm going to wipe this for a minute. And I'm going to let it dry for 2 minutes. All right, and while we're letting that dry, we do have the ambu bag over there attached to the 100 O2. We have the working suction. It's at 120 and it is set at continuous and it's working. Ambu bag too. And right here we have the trach care kit. We have the new inner cannula. We have 2 trachs, the current one and the new small one. We have the new stabilizer, the sterile suction catheter, and the sterile disposable container. We have the sterile saline. We have the sterile gloves over there, and we have the drape for you, my friend. All right. So now that it's been 2 minutes and the table is dry, that's it over there. Do hand hygiene. I think the glove hit the edge of the table, but I would wipe it down again with gloves, of course, hand hygiene. All right, get that. Hand hygiene. Now I'm going to set my materials, my supplies closer to me for easier access. And I'm going to place this drape over you. All right. Now, I am going to take off these gloves. hygiene, 20 seconds. I always do 20 seconds. Gloves. I'm going to open this kit. Take out this sterile suction catheter. I'm going to attach it. Normally, I wouldn't be reaching over the patient, but because of my setting right now, I have to. In a real hospital setting, I wouldn't. All right, so now it is attached. It is working suction. I also have my bag valve mask over there. It is attached to 100 O2, and it is also working. It's working, functioning, and it's functioning properly, okay? And now, all right, hand hygiene. Going to the gloves. Going to set this out. I'm going to toss this. I'm going to open the sterile saline and pour it in. Pour it halfway. Okay, that's good. And now I am going to test, see if this is working. I'm going to dip a bit in and then suction a bit out. Oops. The green. Pull slowly. Alright, it's working, it's suctioning. And in a normal hospital setting, the suction would not be laying on the bed like that. That's just a setting. Alright, and now I'm going to hyperoxygenate you. I see your O2 set is at 97%, so I'm going to take out your O2 source. It's at 97%. I'm going to hyperoxygenate. When I hyperoxygenate, I'm going to secure the faceplate. I'm going to give you 3 breaths. Each breath, I'm going to hold 3 seconds. And between each breath, I'm going to wait 6 seconds. So 1, 2, 3. 1, 2, 3, 4, 5, 6. 2, 3, 4, 5, 6. 3, 2, 3, 4, 5, 6. All right, you did good. Your O2 sat is now at 100%, so I'm going to perform the suctioning now. I am going to suction. It is going in, the inner part is going in. Yeah, when I feel resistance or when my patient coughs, I am going to stop and I'm going to pull back. I feel resistance, so I'm going to stop, pull back, slowly, twisting, suctioning. All right. And how was that, Mr. Peters? Was that better? Do you feel better? All right, that's good. And do you need another pass? No? All right, if you needed another pass, I would wait 30 seconds before suctioning again. All right, so now I am going to dip this into this disposable container. I'm going to suction in some saline to flush this. Suction, all right. Oh, that's good. All right. Normally, the wire will not, or the IV will not touch that inner cannula, but because it is setting, it would. Just pretend it didn't. And now I am going to look at your O2 set. Or it's at 99%, so there's no need for hyperoxygenation. I'll replace your O2 source. All right. I'm going to take off my gloves. How are you feeling, Mr. Peters? Good? All right. Do you feel any pain? No? Okay, that's good. I am going to put on new pair of clean gloves. I'm going to open my trach kit. I'm going to pinch, get this. All right. to pinch and get the sterile gloves, put it over here, and I'm going to pour the sterile saline over here on the side. Pour, pour, pour. All right, I have sterile saline now, and I am going to put this over here, this excess, and I'm going to use sterile technique and open this this inner cannula. Careful not to touch the inside, and I'm going to drop it in. All right, it's dropped, like that. Drop this off. All right, I'm going to put on my sterile gloves. For this hand, all right, I'm going to dispose of this, and now I am going to reposition my cannula. I'm going to dip my Q-tips. I'm going to dip my gauze in the sterile saline. Dip this in the sterile saline too. Alright, so now with my non-dominant hand, I'm going to the O2 sat, the O2 source, and your O2 sat is at 98%, so that's good. I'm going to secure your faceplate with my non-dominant hand. Take your old inner cannula out. I'm going to put this in. All right, are you feeling any pain? No? All right, that's good. You're a soldier, Mr. Peters. All right, I locked it in. All right, that's good. And now I am going to change your dressing. So I'm going to take this out. While I took that out, I noticed that the site had no redness. The trach is good and the stabilizer is good. So, all right, that's good. I am going to clean the site. I am going to clean under this quadrant. Excuse me, clean this quadrant. Clean this part of the peristomal area. All right. Going to clean this side now, underneath, back and forth. I'll clean this part of the peristomal area. All right. And I'm going to scrub the top of the the faceplate. All right. Scrub, scrub, scrub. All right. Now I am going to wipe with wet gauze. Wipe. All right. Wipe. All right. Now I'm going to pat dry with the pat, 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 pat. Pat, 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 pat. All right. It's dry. And now I'm going to place your new dressing on. How are you feeling right now, Mr. Peters? Hanging in there? That's good. Feeling any pain? No? Alright, that's good. Alright, now the dressing is properly on. I am going to replace your O2 source, put it there. All right, it's good. Now I am going to just get rid of this kit. This. And now I'm going to change your stabilizer. Put on hand hygiene. Normally for the changing your stabilizer, I would need another nurse, but I don't have another nurse with me right now. So I'm going to perform it alone. In a real hospital setting, I would have another nurse helping me. All right. I'm going to get this ready. This is the same exact blue one that you have. All right, so I'm going to get this ready. Take your O2 source out. It is at 98%, so that's good. And my other nurse would secure the faceplate over there while I untie this. I'm untying it, and then untying it, and then I'm putting the new one in. So putting the new one in. This is the new one. New stabilizer. All right. And Mr. Peters, you're going to have to lift your head up just a bit for me. All right. Other nurse, help me out. All right. I'm going to place it over. All right. It is now over. I hope. No, it's not. Just a bit more. Just a bit more. All right. Thank you, Mr. Peters. Now I'm going to untie this part. I would secure this part. The other nurse would untie this part. Untie. Putting this new one in. It's untied. Putting this new one in. This is the new one. All right. How is that, Mr. Peters? I'm going to toss this one. And I was assessing the site. I was assessing your neck. There was no skin breakdown, so no redness, so that's good. And I'm going to put 2 fingers in to check for placement. Looks like it is good placement. All right, that's good. I'm going to replace your O2 source. Your O2 set is now at 98%, so that's good. It's been steady. All right, so now I'm going to clean up my area. Clean. Oh shoot. Clean. All right. And do you have any questions for me, Mr. Peters? No? All right. How do you tolerate the procedure? How's the procedure for you? Was it good? Yes? All right, that's good. And let's see here. I am going to look at your vital signs. Your vital signs are stable right now, so that's good. Do you feel any pain? Are you feeling any pain right now? No? All right, that's good. Do you have any difficulty breathing? No? Any shortness of breath? No? All right. Your O2 stat is at 98%. All right. So now I'm going to listen to your lungs. All right. Breathe in deep for me. All right. Okay. Now your lungs definitely do sound a lot better, so thank you. Oh yeah, I had my mask, my goggles, and my face mask on, and you had your mask on too, so there's no need for putting on masks during this whole procedure because of COVID, but yes, thank you. And I will have your call bell right here, within reach, all right? And there's, by the bedside, there is the ambu bag, there is the clean suction catheter, so that's good. And I'm going to document the day and time of this procedure. I'm going to document your tolerance of the procedure, which was good. I'm going to document the peristomal site. There was no redness. That's good. That's very good. I'm going to document your vital signs, your O2 set, which was all normal. That was good. And I'm going to document the respiratory assessments I did, which throughout the whole procedure, which was good. All right. Thank you, Mr. Jordan Peters, for your patience and time. Thank you.